Hi, my name is Dr. David Quartell, and I'm a chiropractor at Quartell Chiropractic. And this focus today is going to be on how stress is destroying health and quality of your life. Just to start, a little bit about me. I'm a family and wellness chiropractor since the 1990s. We focus on the nervous system and chronic health challenges in our office. In 1998, I was an associate professor of chiropractic technique at Life University in Marietta, Georgia. It's almost a quarter century ago. And at Quartell Chiropractic and Acupuncture, we have a cooperative team of 3 doctors, 4 therapists, and an admin staff that allows us to deliver health care. I'm going to start just by discussing this term here called salutogenesis, and it defines an approach that focuses on factors that support human health and well-being rather than a focus on factors that cause disease. And during the presentation, you'll see what I mean. Some of the information that we get is from these books and publications, as you can see here, as well as others, and they'll be documented through the entirety of the presentation. There are 3 types of stress that cause both acute dis-ease and chronic disease in the body. And it's physical, chemical, and emotional stressors that cause problems within our body. The first one, these are emotional stressors. And examples of emotional stressors include relationship problems, anxiety regarding an upcoming event like an impending marriage or the birth of a child, overwhelming workload, the health of ourselves or a loved one, bullying, or any sort of type of stress and pressure you could think of during the day is a stressor that can be emotional that has an effect on our body. These are examples of physical stressors, and some physical stressors that we see right here, text, neck, very common one. Other physical stressors, lack of sleep, smoking, drugs, hectic lifestyle lead to physical tension, overly demanding sports or exercise schedule without adequate rest, a sedentary lifestyle, a couch potato. These are all physical stressors. We also will see an example of other physical stressors that include both that we see as pain in the body, but we also have injuries, and these are macro traumas, which is a major fall, accident, or other activity that would result in an acute injury that we can see, and micro traumas. These are overuse or repetitive use syndrome, irritated tendons, tendinopathies, knees. We see a lot of shoulders, and these will also be classified as different physical stressors. And then we have chemical stressors. And chemical stressors are different types of stress altogether because they happen to us sometimes we don't even know about them. Herbicides and pesticides in our foods. We might see household cleaners or products we use in and on our body, like body products. We might have food additives and sugar, antibiotics, hormones in our foods and that we take. And these are all different examples of stressors that happen to our body. Understanding stress is super important, but how does this information help you? The first way that understanding stress is we know that it's a fundamental underlying cause of body change. Good stress can help build, and negative stress can damage tissue. And we also want to understand how stress changes the body, and that can help us avoid injury and build overall better health. There are 2 types of stress that we're concerned with today, not the physical, chemical, and emotional, but the way that they affect the body. So there's eustress, which is a good stress. It's positive, it energizes, it's usually short term, but it can improve performance. And then there's distress, and this is the stress that we oftentimes think about with bad stress. And it has negative implications. It's unpleasant, depletes our energy, decreases our performance. It can lead to physical illness, mental fatigue, and even emotional depletion. Distress, or the bad type of stress, the one that we consider to be negative in our body, is the one that we typically associate with demographic groups, gender, health conditions. It affects everybody. Baby boomers, almost 60% of baby boomers have never been diagnosed with a mental health issue, yet 52% of Gen Z has been diagnosed with stress and mental health issues. So it's on the rise in younger populations. We see that 57% of Gen Z say they're almost paralyzed by stress and anxiety. And we know that it's taking a serious toll on our physical health. And I'll show you how that is in a moment. These are common stressors that are considered very or somewhat significant sources of stress. This is from the American Psychological Association. We know that we worry considerably about money, work, the economy, family responsibilities, and personal health concerns. And these cause us to have an emotional load, and it takes up vital brain resource that affects us. And I'll show you again how that'll do that in a moment. We know that 1 in 5 Americans say that tech is a major source of stress, and 43% of Americans identify as constant checkers of their device. Now, if you notice, this was from 2017, pre-COVID. These numbers are significantly higher today. I don't have the exact figures, so that's why I put these in, but it's only gotten worse. We know that symptoms of stress are significant. 75% of Americans report experiencing at least one symptom of stress in the last, in the past month. And we can see, I'm just going to change this over here. We see, different types of stressors occurring. Just even, fatigue, feeling overwhelmed, depressed, and sad. Again, this is from 2017. These numbers have gotten worse since then. These are common effects of stress. When we talk about stress, particularly distress, we see the effect on our body being significant. It can give us symptoms: headache, pain, fatigue, stomach problems, change in sex drive. It can affect our mood, giving us anxiety, feeling overwhelmed, irritable, anger, sad, depressed. And even more so, it'll affect our behavior. It might change our eating habits, cause us to withdraw socially, turn to drugs, alcohol, tobacco, less exercise. So these stressors actually cause the feeling bad and create lifestyle change in a negative way. These are the different body systems that are affected by stress. I'm just going to move this over here again. What we can see, the body systems affected by stress include our brain, our skin, our heart, our stomach, intestines, joints, muscles, pancreas, diabetes and blood sugar dyscrasias, our immune system, and our reproductive system. It's not exhaustive of the list, but this is a pretty significant list of how stress affects the body. And let me just move this over here. So this is a funny book, or at least the title's funny. Why Zebras Don't Get Ulcers. And this book, part of the book talks about how stress-related diseases emerge because we so often activate a physiological system that was evolved for responding to short-term acute physical emergency, like a zebra running away from a lion, but we turn it on for months on end, worrying about mortgages, relationships, and promotions. So what should be just a quick short burst for us, like a zebra running away from a lion, it's as if the zebra is running from the lion continuously all day, every day, and it changes the physiology inside of our body. This is a slide that shows Dr. John Cryan talking about how stress alters the gut-brain axis. And it's important to note that neurological stress causes dysfunction in the control pathways for our organ systems, especially the digestive tract. And we know that it affects the digestive tract, the way that our brain is connected, because we've had feelings in our gut, like gut feelings. If you have emotions, a lot of times we can feel them down deep because of the gut-brain axis. And stress affects the gut-brain axis. We can feel that happening. We also know that the gut is significantly more than just our stomach. It contains over 1 trillion bacteria of 500 to 1,000 different species. 90% of the body's serotonin is made in the gut. It's associated with our mood and our attitude and the way we have motivation during our day. And 70% of our immune system and our immune cells are within our gut and our digestive system. This is because most of the first time that we interact with our environment through our day is through the foods that we eat. So the gut, of course, is a super important structure in the body. Stress in the gastrointestinal system. So we know that the gut can be affected by stress. GI tract movement disorders, constipation, diarrhea, increased irritability, inflammation, or you might have Crohn's disease or irritable bowel syndrome, ulcerative colitis, altered GI secretions. Serotonin is made in the gut. It can change the amount of serotonin we make. We can modify the permeability of the intestinal barrier, a leaky gut syndrome. We have negative effects on blood flow to the GI tract, And it can also negatively impact our gut microbiome and creating a dysbiosis. Distress has an effect on the gut in this and many more ways. Stress affects the cardiovascular system. And again, I'm not telling you any information you probably don't already know, but it is significant how it affects the body. I'm just going to move this up here and then come back. Stress causes autonomic nervous system activation. We're going to talk about the autonomic nervous system in a few minutes, by negatively affecting the cardiovascular system. Stress will alter the heart rate and blood pressure. Stress creates an increased cholesterol, changes in blood chemistry, vascular changes, atherogenesis, or diseases of the arteries can happen secondary to stress. It can lead to cardiac arrhythmia and even cardiac damage. We know that that heart attacks and cardiovascular events occur in a much higher rate in high-powered stress type A executives, because it eats away at the autonomic nervous system and it causes bodily problems. Here is how stress affects these are some of effects to the immune system from stress. We'll talk about how it happens in a moment. But it causes immune system dysregulation, makes you more susceptible to infections. We saw this with COVID. People that were under a significant load with stress in the body, had worse outcomes with COVID. It worsens outcomes from viral and bacterial infection, again, such as COVID. It's associated with increased disease and death rates, and it negatively impacts wound healing. Right? So stress impacts so many different systems. Right? It affects the brain. And we know that the effect of stress on the nervous system, we've known this for over a century. Right? Chronic stress leads to a decrease in brain mass. Your brain actually gets smaller when you're under chronic stress. The amount of brain mass decrease is directly related to the level and the duration of stress. So the more stress and the longer you're under it, the smaller and smaller your brain gets. Stress can cause structural changes in the brain with long-term effects to the nervous system. So it not only affects the organs, but it's affecting the control center for those organs. So it's like a double whammy. So this slide here shows the levels of stress at different amounts. So performance will increase as your stress level increases, right? So we see if you're not doing enough, you're not training enough, we're not going to really have enough of a response. Imagine you're lifting weights. If you have a sweet spot, you're engaging in just enough stress for the body, and we'll talk about that type of stress in a moment. It's going to cause you to build stronger body and more resilience. But when we lead to too much stress, or it's distress, or the bad type of stress, it causes breakdown of the body and it causes disease. So there is an amount of stress that is beneficial and healthful, but unfortunately we're responding oftentimes to too many stressors coming in, living in a Western lifestyle. Stress was originally defined, this is Hans Selye, and Hans Selye was the scientist who defined stress and really brought it to the forefront as far as a concept. And he was quoted as saying, it's not stress that kills us, it's our reaction to it. So we don't have to worry about becoming living in a stress-free environment. We have to work on reacting to our stress. How do we better manage the stress that we're under all the time? And I'm going to show you how we do that in a moment. Oops, let me do this here. Vertebral subluxation. We're going to talk about this quite a bit through the next several minutes as well. Vertebral subluxation is a misalignment of the spinal column which negatively affects the neurophysiology of the body. Stress causes vertebral subluxation. Just as it causes so many problems in other organ systems that we spoke about earlier, we also know that stress is the primary cause of vertebral subluxation. And stress does this through what are called the 3 T's, right? Trauma, toxins, and thoughts. Physical stress, these are traumas. Chemical stress, these are toxins. And emotional stress, these are our thought patterns. And this all impacts the autonomic nervous system, creating an imbalance. Again, we're going to talk about the autonomic nervous system in a moment. It makes the body out of balance and it leads to subluxation. And we know that negative body reactions to stress is the number one cause of spinal subluxation. Now, spinal subluxation, before we go any further, I'm just going to define that for you. It's a chiropractic subluxation, or the subluxation complex, the vertebral subluxation complex, is a spinal condition that has altered vertebral motion, it creates irritation to the nerve, it alters the function of the surrounding structures, and it causes changes to the surrounding body tissues. So we might get inflammation, swelling, pain. There might be edema or muscle spasm or muscle weakness, tenderness to the area. We might see redness. These are all common signs associated with subluxation in the spine. And these are things that we look for. And when you've been in the office, we've been able to point them out to you. So how does vertebral subluxation complex affect the body? And these are warning signs of spinal misalignment. And I'm going to relate this back to stressors in the body and how the stress affects the body. So the first thing that we want to talk about is the autonomic nervous system. I'm covering this up here. Oops. This is the autonomic nervous system in balance, right? So the autonomic nervous system in balance helps us to maintain our body response to stress, right? So we have the parasympathetic. This is our rest, digest, repair, and development. We know that the parasympathetic is associated with growth and potential and resting and rebuilding. And then there's the fight or flight and freeze, and that's a sympathetic. And this is for our survival. And too often we live in a world where we're constantly overstimulating the sympathetic and under stimulating the parasympathetic. In other words, we're not resting our body enough and recovering our body enough, so we're not stimulating this enough, and then we're overstimulating the sympathetic with life stressors that we engage in. Right? So these are signs that you have an autonomic imbalance. Right? A low parasympathetic might be associated with constipation, depression, hormonal imbalance. We might see chronic fatigue, brain fog, mood issues, memory loss, autoimmune. When we see problems with high sympathetic activation, diarrhea, poor sleep, irritable anxiety, hypertension, high blood pressure, tense muscles, high cholesterol, hormone imbalance, weight gain, pain. And these can be in both columns. Sometimes pain can be secondary to high sympathetic or low parasympathetic, or a combination of the both. Heart rate variability, and we're going to talk a little bit about heart rate variability, and the reason we do that is because it's a good way that we can measure the health of our autonomic nervous system. Heart rate variability is the gold standard in healthcare for measuring the body's ability to adapt to stress. These are tools that we use to measure heart rate variability: a Fitbit, an Apple Watch, the Whoop, an Oura Ring. And the heart rate variability, we measure the time between heartbeats, and this gives us a number, and we can apply this number to our overall health and well-being rating. Right? We know that heart rate variability is used to measure the ability of your body to adapt, resist, rest, heal, and recover. And it's an indirect measurement of your autonomic nervous system health. And we know that we have low adaptability when we have poor heart rate variability. We have imbalance in our heart and our mind. We get easily exhausted, reduced physiological function. And we have an increased adaptability or high adaptability. We have better physical performance, enhanced cognition, enhanced thinking, good sleep and recovery. And this is a better regulation of the autonomic nervous system. And thanks to heart rate variability analysis, it's possible to determine the prevalence of symptoms of the parasympathetic or sympathetic activity without even knowing it. We can measure it using these tools, and these are things we do in the office. Heart rate variability can impact our overall health, from depression, low energy, a greater sense of well-being, better sleep when we have higher heart rate variability. It's something we greatly encourage you to measure and monitor. We also know that beyond a doubt, adjusting the spine improves brain function. It changes brain activity by 20%. We know that spinal function does affect brain function, and changes that we see in the brain when we adjust the spine occur in the prefrontal cortex. And this was studied quite extensively, and it's been published as recently as 2016, but it's been known for many years. We also know that structure affects our function. So there's a neurological and physiological impact of the vertebral subluxation. When we have subluxation in the spine, compression, irritation on the nerve from misalignment of the vertebra, we see autonomic nervous system imbalance. I'll show you some research in a moment that shows that. There's a decreased blood flow to the brain, increased inflammation in the body. There's mechanical spinal cord tension and cerebrospinal fluid flow alterations, and all of these contribute to neurological problems that we see associated with spinal subluxation and autonomic nervous system stress. Here's chiropractic in the autonomic nervous system. This is a great study because it shows, well, it didn't show how, but it demonstrates that chiropractic care shows a significant improvement in heart rate variability for people that just come in for one visit and other people that come in for 4 weeks of visits. So the more that you do, the better it is. But just even one visit can improve your heart rate variability. It has a healthy autonomic nervous system balance after correction of vertebral subluxation. And again, this is published in 2006. We see that adjustments of the neck have a parasympathetic effect on the body. Cervical adjustments, parasympathetic response. Thoracic adjustments, mid-back adjustments, sympathetic response. So we can affect different areas within the autonomic nervous system by working on different levels of the spine. Upper and lower cervical adjustments, sympathetic and parasympathetic, lumbar and cervical. So these are different tools that we use to help us determine when, where, and how to work on and adjust the spine to enhance neurological function, enhance the autonomic nervous system that controls and coordinates all of your bodily functions. Here's a patient that we had who had a lot of heart conditions, and he's ready to give up. He had tried everything for regular heart function and back pain, including cardiologists. He was an MMA fighter, left unable to exercise or wash his car because of pain and fatigue, and then tried chiropractic just for the pain. But he noted that after the first adjustment, the pain was leaving, but the energy returned. And this was because we were able to reactivate the sympathetic nervous system that controlled the heartbeat and the heart rate, and able to turn that back on. He was able to get better heart rate and heart function. So this was a great success story we had. We know that blood and cerebrospinal fluid is changed with misalignments of the upper neck. It causes nerve compromise, and it obstructs the flow of blood and cerebrospinal fluid through the through the area of the upper neck and the head. This is research published in 2017. So what causes the vertebral subluxation? Right. So there are many things that can cause vertebral subluxation, but it's primarily stress. It's the physical stress, the chemical stress, and the mental stresses, or the 3 T's, the trauma, the toxins, and the thoughts that create stress that lead to subluxation in the spine, as well as other bodily problems. But when we improve the spine and we improve the nervous system, those other bodily problems seem to lessen as well, and I'll show you that in a moment. We know that birth trauma, one of the T's, trauma. This was back from 1987. So we've known this for decades. That infants get a lot of birth trauma. It's really hard coming through the birth canal with the head. 80% of infants are found to have neck alignments of the vertebra, neck alignments and misalignments. And if left uncorrected, they have a tendency toward creating permanent problems, permanent neck problems. And then we couple that with looking at a phone all day. It's a wonder chiropractors aren't any busier than we already are. Here's the impact of autoimmune disorders. We're going to talk about the autoimmune connection in a moment. There are over 100 different autoimmune disorders. Over the past couple of decades, we've seen an increase, a 300% increase in autoimmune conditions, much more prevalent in women than men. We spend over $100 billion a year on treating autoimmune, and 50 million Americans, have some sort of autoimmune disorder. And we'll talk about those in a moment, which ones those are. But we see that this is a concept that's important that I think to note, that we're so concerned with breast cancer. 1 in 69 women, right, which is like about 1 in 70 women below the age of 50 will be diagnosed with breast cancer. And I'm not discounting breast cancer. It's an awful thing. I have family members that have had it. It's a terrible thing to have to deal with. But we spend so much time worrying about that when as many as 1 in 9 women of childbearing years will be diagnosed with an autoimmune. And autoimmune disease can be just as debilitating as a breast cancer diagnosis. Autoimmune diseases can be deadly if left uncorrected, untreated for a long time. They create inflammation and cause problems in the body, just like breast cancer. But going through a breast cancer treatment is difficult. Same as living with an autoimmune illness can be very difficult. We see it so much more, yet we almost ignore it because there's no, we don't really know how to treat it that well. I'm going to show you how we can help it here, right? These are types of autoimmune diseases. We see in the brain multiple sclerosis, Guillain-Barré. We see in in the blood, the gastrointestinal system, the nervous system. We have lung, skin. Skin is a big one. Muscle, bone, thyroid. These are all areas where we can see different autoimmune disorders, happening in the body, and they're becoming more and more and more common all the time. Like, how many people do you know that are on a thyroid pill, right? Or somebody has some sort of a skin disorder, right? Like, these are very common. Or somebody has some sort of a irritable bowel syndrome. Like, these are autoimmune type Crohn's disease, autoimmune type problems. Anxiety, another one that we're going to talk about, how it's connected again to the spine and the nervous system, and dealing with stress and decreasing stress in the body. So we know that anxiety is the most common mental illness in the United States. Approximately 40 million adults have some sort of anxiety disorder in the U.S., about 18% of our population. And we spend almost a third of our total mental health bill on anxiety, or over $40 billion a year on anxiety. And it's awful because it's something that is addressable. I'm not saying that it's curable in every condition, in every case, but it's very addressable. Right? We see 1 in 8 or 9 million children have some sort of anxiety disorder, and it's becoming more and more common, especially after COVID. We know that depression, along the same lines with mental health, the anxiety, depression, it's a number one cause of disability worldwide. It accounts for 13% of the total global disease burden. And by 2030, it's expected to be the largest contributor to disease burden in the United States, in the world. And there's extensive research that links depression to the gut-brain axis. And we talk about how stress affects the gut-brain axis, and you reduce stress, improves the gut, improves the brain. Many times we see disability and mental disorders and depression lessen, which is great. Even if it's improved, I oftentimes say, if we improve it by 20%, it doesn't sound like it's that much. But if we say, what if it gets 20% worse? That sounds like a lot. So even improving it by 20% has a major impact on your overall life and well-being. We see 1 in 33 children and 1 in 8 adolescents report some sort of depression, at some point. Here's how stress, inflammation, and depression all affect. We know that from stress to inflammation, it's a major depressive disorder. Again, these are historical threats. A saber-toothed tiger, attacks from tribes. It was a one and done, like a little bit of stress and it was over. And then this is a pro-inflammatory immune response. This is short-term benefit. It was respond to an actual physical threat. These are contemporary social threats: anxiety, social, yelled at, family, online. This is showing some bullying, and it's these long-term stressors that create problems. It activates modern-day social, problems, imagined threats, and it leads to pro-inflammatory changes. It leads to inflammation within the body, chronic pain, metabolic syndrome, rheumatoid arthritis, cardiovascular system diseases, obesity, neurodegeneration. We see coming from all these chronic long-term stressors. So how do we get the body to respond better? Like Hans Selye said, we can't stop the stress, but we can learn to deal with it and mediate it, right? So here's one that showed the connection between the gut and the brain in managing stress. So here's the psychobiotics and the manipulation of bacteria gut-brain signals. So this is Dr. Cryan. We saw him a couple of slides ago, and some other researchers. What they did was, it shows the vagus nerve, again, the nervous system, the autonomic nervous system, mediates the relationship between psychobiotics and their psychophysiological effects. So what they did was, they found that by putting certain bacteria into the gut of mice, they were able to change the mice, the way that the mice were acting and interacting with each other. And they found that by manipulating the gut bacteria, they could make the mice more social, they could make the mice less social. These were called psychobiotics. Psycho meaning associated with the brain and mental state, and biotics meaning, a bacteria. Then they cut the nerve supply to the gut. So the bacteria were still in the gut, but they cut the nerve supply to the gut, and they found that the changes were no longer present. Even though the bacteria were still in the gut, it was the nervous system interaction between the gut bacteria brain signal that was really associated with the changes, and that's why we call the gut brain axis. Right? Which is why we spend so much time focusing on gut health and nerve health for the way that we feel and function. Here's another patient that we work with. She was told that her stomach issues were genetic, that there was nothing that she could do about it, that her father died of ulcerative colitis, both of his parents died from bowel disease, and her symptoms were getting worse, and she tried that, figured she had nothing left to lose, so she tried chiropractic. We found that she had an imbalance in her autonomic nervous system and spinal dysfunction. It was a couple of adjustments, a couple of weeks worth of care, but able to get a complete correction. And then I like this down here. I know that Dr. Quartell doesn't recommend it, but now I eat anything that I want, and there's no more bloating, pain, constipation, or diarrhea. That's not entirely true. When she eats really poorly, she has some symptoms, but she's no longer a slave to the toilet, which is where she was at one time. This here shows altered vagal tone affects the autoimmune and chronic disease state. Right, so we see that the vagus nerve and autoimmune problems and chronic disease from the nervous system. It affects rheumatoid arthritis. It'll predict rheumatoid arthritis to develop if there's autonomic dysfunction. If there's autonomic dysfunction, the risk of sudden death increases, as well as lupus and rheumatoid arthritis. We see autonomic dysfunction is associated with multiple sclerosis. Autonomic dysfunction is associated with Alzheimer's disease. Again, it doesn't mean that the autonomic dysfunction is the only thing that's causing this, but it's one of the major factors. And if we can reduce multiple factors, if we can reduce multiple causes, the chances of you having problems, Alzheimer's disease, sudden death from a heart attack, rheumatoid arthritis, it's a good thing to reduce risk factors, right? We see here autonomic nervous system associated with chronic fatigue syndrome, fibromyalgia, even Parkinson's with autonomic dysfunction, right? So it's something to look at. So this here, the Journal of Physiology shows the vagus nerve has anti-inflammatory properties. Remember the vagus nerve, they cut that, the psychobiotics one. So additionally, the vagus nerve, it's called the vagus nerve because it wanders throughout the entire organ systems all the way down to the mid-gut. Given its position as a key element of the autonomic nervous system in the brain-gut interactions in irritable bowel disease, the vagus nerve seems to be a good therapeutic target for inflammatory conditions. In other words, according to this study and others, if we improve the function of the nervous system, we can get rid of inflammatory conditions, or at least help them lessen, which is huge. If you have inflammation, everything now is de-inflame, detox. You can do it through improving the nervous system, the autonomic nervous system tone. Here was the pulse of inflammation and heart rate variability, the cholinergic anti-inflammatory pathway and implications for therapy. So correction of chronic maladaptive levels of inflammation using a nerve stimulator, the vagus nerve, might prevent the progression of debilitating and deadly diseases. So how do we stimulate the vagus nerve, right? Naturally. So we can, positive social relationships. This is huge to improve your vagal tone. Cold immersion, cold plunging, even gargling, singing, chanting, humming, these you feel better when you sing. Massage helps, laughter helps, yoga, tai chi, breathing deeply and slowly, taking a improves vagal tone, breath exercise, regular exercise, and chiropractic care specifically to the upper cervical spine and the the skull and the vertebra that are misaligned and irritated will help to improve vagal tone, and improve your body's ability to get rid of inflammation, which is secondary to stressors. Um, Chiropractic and vagal tone here. It's my, let me pull this off here. Chiropractic and Vagal Tone, 2006 Journal of Manipulative Physiological Therapy. We see that a decreased heart rate and increased total power from heart rate variability analysis indicated a healthy autonomic nervous system was in balance after correction of vertebral subluxation. In other words, by reducing the irritation to the body through spinal alignment, through chiropractic adjustments, we're able to improve autonomic nervous system balance, which then has positive effect on autoimmune problems, digestive problems, inflammatory problems, the brain size. We talked about the brain size. We talked about how it affects the gut-brain axis, our mood, and our attitude. So all of this is very helpful just by working on some of the nerves that come out of the spine. What is a vertebral subluxation? We talked about this earlier, but it's a misalignment. It's a vertebral subluxation is a misalignment of the spinal column that negatively affects the neurophysiology of the body. So when it misaligns here, we can see problems radiating down from the neck into other areas of the body, wherever it's connected. Right? We know that the structure affects function, the neurological and physiological impact of vertebral subluxations. It creates a negative neuroplastic and autonomic changes, which means that it changes the structure over time, that the longer this is there, the more permanent it becomes. The autonomic system changes over time. We see brainstem blood flow problems. We see inflammation improves when we get rid of subluxation. Cerebrospinal fluid can change when there is subluxation. We can get mechanical spinal cord tension when there's subluxation. So all these directly and indirectly affect our nervous system. Here's just another article on chiropractic and vagal tone. This is from 2008. We know that cervical adjustments may result in parasympathetic response, whereas thoracic adjustments result in sympathetic response. In other words, neck adjustments have a parasympathetic vagal effect, and then, not to discount it, but thoracic adjustments can retonify the sympathetic response. It's easy to make changes once you know how to make the change. This shows chiropractic and decreased inflammation. This was published in 2006. A reduction in pro-inflammatory cytokine secretion was observed in cultures from chiropractic adjustment subjects. So when we look at the blood, we can draw blood, we can see physiological changes actually in the bloodstream associated with decreased inflammation after chiropractic treatment of subluxation that's affecting the autonomic nervous system. Here at chiropractic and vagal tone, we know that a vagal tone may be assessed by evaluating local tissue changes. So not only can we note heart rate variability, which is good to measure, but we can also see swelling, edema, temperature, muscle tone, spasm or flaccidity, joint motion, pain, tenderness. All this can be seen through chiropractic analysis. Skin temperature, asymmetry. Right, based on assessing normal individuals, we know where it is, and this is why we use our hands to find the areas of problem. Vagal tone, heart rate variability in the gut-brain axis. We know that there's a tremendous connection between the vagus nerve and the heart, lung, liver, gallbladder, spleen, stomach, pancreas, large, small intestine. The autonomic nervous system is goes to this entire area, and the vagus nerve hits all the way down and through the small intestines here. Here's just more review of the literature. I mean, I like studies from 2012, heart rate variability and irritable bowel syndrome. We see that patients with irritable bowel syndrome appear to experience symptoms that may be the result of changes in the autonomic nervous system. We see here depression and anxiety exhibit abnormally low heart rate variability compared to controls, right? So low heart rate variability, high frequency of depression and anxiety. How do we improve heart rate variability? Well, we do so by improving the autonomic nervous system. And how do we do that? By managing stress. And how do we manage stress? Well, by managing the nervous system through chiropractic adjustments. It works every time. Here, conclusion, from a study in 2013, heart rate variability in patients with fibromyalgia, chronic fatigue syndrome. Fibromyalgia patients show more heart rate variability, aberrants, and indices of increased sympathetic activity. That's why we might want to adjust the thoracic to tonify the sympathetics. We see that antidepressants and selective serotonin reuptake inhibitors worsen imbalance of autonomic dysfunction and major depression, right? So overall shift of autonomic nervous system imbalance towards sympathetic dominance with decreased parasympathetics, right? So patients suffering from major depressive disorder show profound autonomic dysfunction. Let's help the autonomic nervous system, right? If that's a potential problem. And again, the autonomic nervous system is associated with, survival, digestive function, secretions, your heart rate, your breathing, your saliva, your bladder, right? And it's associated with growth and potential, rest and repair. And if the resting, digesting, repair isn't activated as much as it should, we're in a constant state of fight, flight, or freeze. This imbalance creates disorder and imbalance of all these organs here, all these organ systems. Right? So these are just some side benefits, a review of the literature, objective physiological findings or physiologic changes, and associated health benefits of chiropractic adjustments. So we see a change in the autonomic function, endocrine function, cardiovascular, change in our immune function, muscle strength, overall athletic ability, our heart rate variability, our range of motion, our respiration, our reaction time improves, right? Neurocognitive function improves, better information processing. I mean, who doesn't want to think better? Better reaction time, see better, better stress management, reproductive hormones. Who doesn't want more testosterone and a better balance of your progesterone and estrogen? Better recovery time. Reduced labor. I mean, if you're pregnant, of course, this doesn't apply to the men, but all of these are things that are super beneficial. And I'm going to end here with just some testimonials and reviews that we have. This is taken a little while ago, but we have certainly more reviews on Google than that right now. We just have other reviews that come in from different people that are much more recent, and you can go online and hear a little bit more about us and what people say about us and the work we do. But I'm going to end with this here, and this is a great quote. This is B.J. Palmer. He's considered to be the developer of chiropractic. And the beauty about chiropractic is the fact that it works with natural means. It puts nothing new into the body, nor does it take away or any natural gland or organ. Chiropractic simply releases life forces within the body, sets free rivulets of energy over nerves, and lets nature do her work in a normal manner. In other words, if you take away the impediment to health, the response is better health. And so I hope that you learned something new about chiropractic today and why we employ chiropractic as a total body treatment, not just for pain, which it's great at getting rid of, but improving overall body function. Thanks so much. See you next time.